Good evening, everybody. Hopefully, everybody is doing well. A quick reminder regarding how to rule out from Doppler or vascular Doppler studies, how to rule out subclavian steal syndrome. It's very easy, just a small hint, small trick. So it can give us a lot of information regarding the subclavian steal syndrome. Mostly because we all know that mostly if there is a stenosis or occlusion, actually tight stenosis or completely occlusion on the proximal area of the subclavian artery. So what happens if it's on the right side? So the blood come from the left side and just coming from all the way, and it's taking from vertebral of the left, it went to the to make a bacillary. So before that, it just come to the right side, and then from there it just goes to the arm all the way. So we all know that one. So how to rule out with one? It's important how to put your probe and what to do with that. How we can make it easy to diagnose it. So just be with me. Let me show you in one of a small video clip. Let me share my screen with you guys. Okay. So if we look at this video, this is small, it's a very small clip, but I think, let me see if I can make it a little bigger. Okay, if you look at here, if we put our transducer by the distal portion of the CCA, where exactly if you guys see in the small clip, they're going to be a video, they're going to be, you can see this bulbous area. So we're not changing anything except the sound beam. We will turn it, or we will tilt it, or we will angle it more laterally. If it's my right side, so I find that distal portion of the CCA and I tilt it outside or laterally. Or if it's my left side, if I tilt the beam of the sound laterally. So that will give us this easy trick or easy hint. So you can rule out subclavian steal syndrome. So normal flow, like in this, this is my own neck, so I just scan myself. If we look at here, this is the distal portion of CCA. It has to be the same color of CCA, especially the distal portion of CCA or proximal area of ICA. We just compare these two colors. So if we look at here, it's a red color, it's towards the sound flow, and the same thing we have it here too on our vertebral artery. So if we look at on the bottom, these are the vertebrae, the shadows, and then we see a vertebral artery. So the same color rule out and that there is no subclavian steal syndrome. In case if we see these two different colors, for example, if the distal CCA area or proximal ICA area, if that was red and we see this everything here blue, so it means there's a subclavian steal syndrome because this blood is coming from the opposite side. So that will be a strong reason or a strong sign for subclavian steal syndrome. Meanwhile, the patient will have signs symptoms because if you look to the blood pressure on the area where the subclavian artery is blocked, if you look to the blood pressure, that will be really drop on that side also. Not only that, but this is easy way how to diagnose and confirm it with vascular Doppler studies. So normally we say the vertebral artery has to be antegrade flow. When it's a subclavian steal syndrome, so it's a retrograde flow. So that this way, I think that will be more easier. If my CCA is blue but my vertebral artery is red, so it means already somebody just inverted the color for you. So it's better to make your CCA red, and then that will be a landmark. That will be a reference point for us. So let's make our CCA red, and then let's see what is on our subclavian. I mean, sorry, on our vertebral. So angle it more laterally. That was the simple trick. Just angle it to the lateral and match both colors. It has to match each other. So hopefully, I think that was easy trick. Do not change, don't invert, do not take your box steer. Like for example, if you steer the box to the left for the CCA and you steer it back to the vertebral to the other side, like right and left. No, leave the box, leave everything on the spot. Do not steer the box for the CCA one side, for vertebral the other side, because if you steer it, you can falsely give us a negative study. Maybe it's a positive for subclavian steal syndrome. So hopefully that will help you guys, and enjoy your rest of your day. Have a good day. Bye.